Welcome back to From Hello to Help, a podcast series that aims to engage in meaningful conversations about health, human services, and resources essential to the daily lives of Michiganders. I'm your host, Sarah Kyle. Today, we're talking about suicide prevention and specifically the role of 988, a crisis hotline offering 24/7 access for anyone in emotional distress or suicidal crisis. With holidays approaching, we may see extra stress, isolation, grief, or reminders of loss. And for some people, those factors increase suicide risk. If you're listening and thinking something is off inside you, you have some questions, or you know someone who might be struggling, this conversation matters because there is no shame in asking for help. To help us make sense of all of this and offer real help and guidance, I am so pleased to welcome our guest, Amanda Girard, Manager of Outreach at Common Ground. Whether you're dealing with a mental health emergency or need counseling, Common Ground offers confidential crisis support 24 hours a day, 7 days a week. Today, we'll cover how to recognize warning signs, what 988 offers, how to connect people to help, how to support a loved one, and what you might be able to do to lower the risks in your community. Amanda, I am beyond thrilled and so grateful that you're joining us. To start, can you tell us more about your role at Common Ground and how it's connected to 988 in Michigan?
Absolutely. So as the MyCal outreach manager, MyCal is the Michigan Crisis and Access Line. They were the statewide Michigan Crisis Line before 988 went live here in across the nation. My role, I originally started as the 911-988 coordinator. So I actually came from a dispatch center at 18 years in a dispatch center and heard about 988, that it was going to be going live, and really was close to my heart that, hey, this is a different way that I can help. I love to serve people. So moving from 911 to 988 was kind of a seamless flow to be able to serve people in a different avenue. So I was coordinating with the 911 centers here in Michigan, which is still a large part of my role now as the outreach manager. But MyCal, the crisis line, is through Common Ground, which is in Oakland, out of Oakland County. But the crisis line itself, all of our staff is fully remote. So we're all over the state, which is really cool. We've got people from all different parts and taking these calls. So my part as the outreach manager, again, just engaging the 911 centers. I've got outreach specialists that engage with our resource partners to make sure that we're all connecting and on the same page, really to seamlessly serve Michigan. And then I've got an outreach specialist whose specific coordination is with the tribes here in Michigan.
That's beautiful. And hearing that you came from 911, you clearly have some just strength and dedication to the community. So again, thank you for joining us. 988, although it's been around for a minute here in Michigan, there are still some folks who have no idea what the 988 Lifeline is and how it works in practice. Can you share with us a little bit more about it?
Absolutely. So the crisis line itself is not new. It's been around since 2005, I believe, is the National Suicide Prevention Lifeline, which people, when they hear that, they're, oh, okay, that makes sense. So the dialing code, the FCC went ahead and made that dialing code 988 for easier access for people. And that went live July 16th of 2022. And really broadened the scope of the crisis line. So it's not just about, while it is about suicide prevention, it also encompasses people in crisis, mental health crisis, behavioral health crisis, as a space for people to go and easily remember the number, that National Suicide Prevention Lifeline number that they had, the long 1-800 number. If you're in crisis, that takes them, unless you have it saved in your phone, that's going to take a minute to look it up and figure out what resource you have to call in crisis. So this 988 truly made it more accessible for people to immediately call somebody and get the help that they need. And it, again, broadening the scope. It's not just about suicide, anybody in crisis. And what I love about the line, again, moving from 911 to 988, hearing how the calls are, I got trained as if I was going to take the call. So I could truly appreciate and understand what happens when somebody calls the line. And it is, if it is a crisis to you, there is absolutely no shame, no judgment. It's a crisis. and it matters. So that's a huge thing that I think people sometimes think, well, it's not for me, or they hear suicide prevention. Well, I'm not there. It's not for me. It's a resource to call before you even get to that point. And that's kind of where we get to the prevention part of it. But so 988, again, it's that easy 3-digit dialing code. You're going to get a crisis specialist no matter where you are in the country. But Michigan here, each state was left to come up with the infrastructure and handle it within their state. So if you're here in Michigan, you're more than likely going to get, because of the new rules that they have with geo-routing, you're going to get the local crisis center, which MyCal is the statewide 988 center. You will get a center here in Michigan. Now, don't be disheartened if you end up getting a different center for whatever reason. You're always going to get somebody, which is the incredible thing. You're never going to get just left with nobody answering the phone. So we've got other amazing centers around the country that will, once they find out you're in Michigan, they're going to then transfer you to a Michigan 988 center. So you truly are getting local care.
That's beautiful. And coming from another hotline, we know how important it is to have the quickest and easiest access. And I love that you say there's no wrong reason. Like, if you're concerned, pick up the phone and dial. And I hope people hear that over and over as we talk. There's no shame in asking for help. None of us get through this life alone. So having courage to ask for help is really important. Can you help me, though, if I am thinking of this for maybe someone I love? What are some warning signs that I should be looking for?
Absolutely. And that's one thing I can kind of talk about, too, is this line is for third-party callers, too. If you're concerned about somebody, that is your crisis. Mm-hmm. Give us a call and we can walk you through assessment and walk you through how to help that person that you're concerned about. And we have tools to help you assess mm-hmm. those warning signs. Is it a warning sign? And then give you resources to guide that person. Now, the big thing that we talk about with first-party callers and our third-party callers that call in crisis or about somebody else, they don't necessarily consider it a crisis, right? But is collaboration. So one thing when you're looking for those warning signs, you know your people best. And each of us as a support in our village know our people. And when you start to see things, whether they start to seclude and that's isolate, if they're extremely irritable and it's not normal, anything. But if you've got somebody that's at higher risk, you know that there's mental health crisis that they've got history of. Something to do before they even get to that point is come up with these safety plans, and they know themselves best to be able to say what their warning signs are. Like, I know when I start to maybe lack interest in things I normally like, or maybe they're not in crisis yet, but these are the little things that we start to notice before they get there. So come up with that plan together with them. It really should be collaborative. Don't just be kind of as a support person, the eye looking from the outside looking in, trying to figure it out. Collaborate with them, talk with them, and see how they feel. But, let them tell you what their warning signs are. When they're in a good place, come up with this plan and then collaborate with them. What does it look like to help them, to intervene, to support them before they get to that place, and have these steps in already planned out. But the biggest thing, and especially for us on the line, if you call 988 as a first party, third party, is collaboration. We are always going to empower you to make the decisions for yourself, because you can't force somebody, especially somebody that's in crisis. They're already feeling helpless, out of control. So taking that control and making decisions for them is really the hardest thing, unless it's the last thing to try and save their life. That truly is the very, very last resort. It's about collaboration and cooperating with that person.
Can I tell you what I might have heard? And I do love this collaboration, but I also heard you say it's okay to call early. It's okay to call if I have questions, if I'm just concerned about myself, about someone I love. It's okay to call 988 and say, here's the situation. That is what I'm hearing, correct?
Absolutely. Absolutely. We don't want people to wait at all. I mean, I kind of think about it like a fire extinguisher. Like, know where it's at, find it before the fire. There's absolutely no reason that you should be searching around recklessly or having to go buy one when there's already a fire. Call early, get questions answered, get resources. And that's the big, the big thing is we have our 988 center and the access we have to resources all around Michigan for locally for all of our callers to answer those questions and that get them connected. So it's not just a one-time call. So it's like we want to follow through with this and make sure you get the help you need, not just, that moment. So
that's beautiful, but I also know how challenging it must be for your team. So thank you to everyone who's answering those calls throughout the country. In other states and even in ours, we have 211s who do also take 988 calls. And I know those are really hard and that takes a lot for a staff. Can you talk to me about the training that your team might have?
Yeah, so our training is, we have the crisis specialists have a combination of national training that they have to go through through Vibrant, through standards that they have. It's a national curriculum, as well as state specific programs that we have and certifications. So it truly is ongoing. Every year they have continuing education that they need to get about crisis, about de-escalation, about special populations for sure. They're always getting training constantly and renewing it every year to be able to serve the community the best that they can, because things are always changing too. So it's constant training so they can best care for our callers.
That's beautiful, and I would expect nothing less. And I really want to make sure that callers understand this is a specialized service. This is very specific to the needs that someone might call the Lifeline for. So that's beautiful. With all that you're doing, can you share with us any barriers that still exist for folks who might be seeking help? Are there costs, stigma? Tell me what might get in the way of someone saying, I'm going to have the courage to ask for help today.
Yeah, absolutely. Stigma, which I think kind of falls under the myths. Myths are a huge barrier about what happens when you call. It is a confidential line, completely anonymous and up to you. So there was this huge myth, especially when 988 first went live, that, well, if you call 988, they're automatically going to send the police. It's just not true. It's actually less than 0.5% is our average of calls that we have to engage emergency services. And some of those are even voluntary. So it is when I say last resort, it is the last resort to save someone's life. We really want to collaborate and want to empower somebody to make that decision for themselves. So less than 0.5% of our calls are we truly engaging with emergency services. So it is a space where all the rest of those calls that we're able to come up with safety plans, we're able to de-escalate, connect with supports, connect with resources, and handle those calls appropriately. Or without emergency services. So the myths are a huge barrier, but we've been breaking through those, which is amazing. The stigma about calling, that's another myth, which we've kind of already talked about, right? It's for everybody. We all have those moments. A crisis is relative to the person, and so breaking that stigma for sure. Publicizing, and which you kind of talked in the beginning, like when I talk about where I work, people go, my first question after they ask me, what do you do, is, do you know what 988 is? And often the answer is no, which could be, okay, that's a good thing you've never had to utilize it, but you didn't know it was a resource either. So it's unfortunate, but it is, again, the crisis, or the National Suicide Prevention Lifeline, has been out for a lot, 20 some years. It is the 988 portion of it is in its infancy. The dialing code, it's only 3 years old. We've got a long ways to go. So publicizing 988 and the awareness of 988 absolutely is a barrier, which we're actively working on. So people, another barrier when people actually call is that, again, that kind of stigma, that fear of giving any information to their location, county, or whatever, feeling like, that's very personal. but that's a barrier to getting them the most local, most specialized services that really can help them. So again, breaking the stigma to say, it doesn't tell us exactly where you are, but it helps you. So and one other barrier I think I could touch on was just the time it takes, as we're talking about 211. It takes our crisis specialists to search for resources. We have an amazing partnership with 211. I love it. And that's really fostered the collaboration to do better. So figuring out how to streamline the search process for our crisis specialists so that they can really focus on the caller when trying to work through the overwhelming kind of research or the search results that we get. So we have access to so many resources. So just streamlining that to really be able to focus on the caller during the call.
I love that. In fact, this collaboration we have in Michigan between 988 and 211, I think is powerful, leaning on each other to make sure that when the folks who are answering your calls have access to all of the process at 211. And we have some great partnership where we can get folks to you on a warm line. We don't just, hey, hang up the phone and dial. We really do our best to collaborate. And I think that's the word of the day, right? Let's do this together. How can organizations, workplaces, faith communities, school partners, how can we collaborate with 988 to really build a stronger safety net for Michiganders?
I think it starts with breaking that stigma around conversations with the people in your community. Have the hard conversations with no judgment and truly getting to know people where they're at, and then understanding the resources that you have available, which, as we're talking here about 988, understand what it is. There's so many free resources available online to be able to publicize it, to hand out, to from stickers to little cards, to, social media pictures that you can put on your pages, whatever it could be. So is just getting information out there is huge. And the other thing I would recommend is just as if you're a support pillar in your community, make sure that people know that your information, if they're not in 211 or if they're connected with their local community mental health pillars, to make sure that it's just that connection sometimes that gets broken and lost, where a lot of times people just don't even know what resources are out there. Because we have so many great resources, but if we really connect, so people aren't getting lost or resources aren't getting lost or underutilized, I think that's super important. So awareness in all fronts, I think, is huge.
I would 100% agree. And I think some of the challenge, and I know the nuances there, but at 211, we have similarly, just know about us, tell people about us, make sure that the people next to you understand, whether it's your colleagues, the people you live with, the people you work with, letting them know it's okay to ask for help. And really with 911, 988, and 211, there is no need to struggle alone. There really is a place to go and ask for help. And I do love that conversation, to be honest. When I tell someone, yeah, I work at Michigan 211, and they're like, what's 211? My heart both sinks, and then I get to tell you, I get to be the person to talk to you about this really life-saving resource, as well as 988. So that's really beautiful. Can I ask you about the holidays? So during the holidays, people may feel extra stress and pressure. Is there any practical advice that you might have for someone who's feeling isolated, overwhelmed, or realizing that they themselves may be at higher risk?
Yeah, absolutely. And that is just recognizing it, right? And taking the step of reaching out. If you feel like you don't, you're isolating or feeling alone in this season, even if 988 is your one support to call, to be able to kind of, and then lead you to the next support, who can lead you to the next support. I would just say 988 is a huge and resource that you can utilize. So I think, again, we talked about those early. Don't wait. Don't wait until you're completely in crisis and kind of at the end of that rope. Know that even people that kind of know the holidays do bring this out every year. It's something that they go through. That in itself is your warning sign. Like, it's that time of year. What do I do now? Create those safety plans early, and know, what is that step? Is my first step 988? We have an amazing Pure Warm line here in Michigan for people to call. That's if I just need to talk through some things. So know what resources are available ahead of time before you get to the end of the line. And if you did wait, it's okay. It's not the end. We're still here to help at any point in this process for you. So please call. I can just say that should just be your first step. If you don't know what else to do, just call 988.
That's a beautiful statement, and I think it resonates. You talked to us about the phone number. We know, thankfully, hopefully our listeners have heard us talk about a 3-digit dialing code before. Are there other ways to access 988 services?
There are. 988 you can have by calling, by text, and by chat online. So there are those 3 ways to call. You will always get a crisis specialist just ready to help and talk. So
that's beautiful. And Amanda, is there anything you would like our audience to remember as we wrap up this episode?
I think it's just they're knowing that there's people on the other line that truly do care. There is no judgment when you call. It truly is a resource that is for everybody. And that's why I'm so, passionate about, we need to get this more publicized and really, our state's working on getting it more awareness because it is for anybody and everybody. Whether, even if you don't feel like you're in crisis, but somebody you love or know that is your personal crisis, even though it doesn't feel like kind of where we think of crisis, we think of like overwhelming chaos and everything's out of control. Well, it's not where it starts. That's just the worst of the chaos, right? Or the crisis. So truly just know that this is for everybody and call. There's no shame in it. And then we have crisis specialists available 24/7 that truly care and want to really walk you from crisis to hope. So that's what I love about the line.
From crisis to hope. I do love that. Amanda, I honestly can't thank you enough. This is a really tough conversation to have, but one that we know needs to be had all times of the year, not just during the holidays, because we know that crisis, as you said, it can happen anytime and it impacts all of us. Everyone has to ask for help once in a while, so it's okay. Thanks again for joining us. If you're listening, it's really important to understand that you are not alone. Help is available. And for those who want to help others, please feel free to visit commongroundhelps.org for more information. To our listeners, if you need more information on resources, we encourage you to get in touch with 211 for access to the appropriate support for you. Please don't forget to follow us on social media and visit our website at my211.org for more information on the resources available through Michigan with 211. Thank you so much for listening, and we look forward to having you with us next time on From Hello to Help.